From the push for a health system state of emergency to pipeline pressures ahead of the Prime Minister leading a delegation to China. Time now for tonight's politics panel. And joining us this evening, Calgary-based public opinion consultant Janet Brown and Duane Bratt, Mount Royal University political scientist. Good evening to you both. And let's begin with Alberta doctors pressuring the provincial government to declare a state of emergency to better deal with hospitals overflowing with patients. Janet, we just heard from Dr. Raj Sherman, and goodness gracious, he had a lot to say on all of this. What do you think Albertans should take away from these latest efforts by doctors to raise a red flag? What weight does this advocacy carry?
Well, as I was listening to Dr. Sherman, I was thinking about my own polling, and we spend a lot of time in Alberta focused on inflation and the economy and those sorts of pressures. But when you ask people what the most important issues facing the province is right now, they are as likely to say crisis in our healthcare system as they are economic concerns. And sometimes that gets forgotten in the whole Donald Trump, crazy political cycle. So Albertans are very tuned into this issue. They're very concerned about what's happening in our healthcare system, but we're not hearing too much about solutions. So I think Albertans will be very interested in what somebody like Dr. Sherman and his colleagues say about the crisis and how to solve the crisis.
Well, and Duane, he turned to the camera and he had a very direct message to send to the provincial government. So what's to be made of how the Smith government has responded to this point?
They're not going to call an emergency session of the legislature, and I don't think they're going to respond publicly to the calls from Dr. Sherman or Dr. Parks. What the Premier and the health ministers, plural, are going to say is that the government is taking efforts, that this is the point of restructuring Alberta Health Services. This is the point of bringing in private surgical facilities. This is the point of allowing doctors to opt in and out simultaneously in the healthcare system. They are saying they are fundamentally changing healthcare, and it's going to take time to move this aircraft carrier around. It's not easy to do, and I think that's the argument that the provincial government is going to make. But I think Sherman made a very strong point that says they can't use AHS as the whipping boy anymore. The government is in full control of the healthcare system. They have fired CEOs, they have fired boards, they have put mechanisms in the Department of Health. This is the government's responsibility.
Janet, to Duane's point, AHS is no longer the overarching health authority in Alberta. How do you see the handling of these latest hospital capacity concerns being reflected in the fact the system is now divided across four different entities, four different health portfolios?
I think people are just confused. I think if you ask the average Albertan, I don't think they realize, I don't think they could explain the reorganization in healthcare. I don't think they could explain what the four silos are. And I don't think they could be clear on how those silos are going to improve things. But as Duane said, I mean, the government is making a lot of changes and doing a lot of things. And this is an opportunity for the opposition, the NDP, to own this issue. But, they're focused on some scandals, some spending scandals, but we don't hear a lot about the opposition about whether this new reorganization is going to help the healthcare system or not. So right now, Danielle Smith is just talking about a whole bunch of change. She's pushing that change through, and we're not hearing too much from the NDP. So I think the challenge for the NDP is they're looking like they're defending the status quo, and Albertans do want change. We just don't know if we want the type of change the Premier is proposing.
Duane, should Albertans be hearing from political leadership, either from the opposition or maybe more importantly from the Premier herself, from the four health ministers?
Oh, absolutely. But I'm not sure what restructuring will do to help people in the emergency department. And that is what Dr. Sherman was talking about, was the pressures in emergencies. Not access to surgery, not finding a family doctor, wait times in emergency. And we had that horrible death over the holidays of someone dying while waiting for care in a hospital in an emergency room. And I think that's a focusing event where you're not dying at home, you're actually in the hospital where there are doctors who just aren't treating you.
Janet, I'll maybe give you last word on this. What do you make of the political perspective that Raj Sherman brings to this conversation?
Well, I think he's a strong advocate for healthcare. And like I said, healthcare has taken a back seat to sort of the economic crisis that the country's happening, all of the other political chaos. So, as I said, healthcare is just as important to Albertans as the economy. And I think it's just really interesting that we finally have some loud voices getting this story back on the agenda.
All right, time for us to take a bit of a break. But when we come back, Alberta's push for quicker pipeline approval as the Prime Minister prepares to lead a Canadian delegation to China. More from our politics panel in a moment. Welcome back. The Prime Minister is heading for China this evening, and he made a stop in BC before heading across the Pacific.
Today's not a day for big announcements. It is a day, as I say, for dialogue, for listening and working. There will be a time for coming back with progress, particularly with respect to conservation.
The PM there, ahead of a meeting with coastal First Nations, a meeting that comes in the wake of Alberta's latest push for quicker project approvals. In a letter to Mark Carney, Danielle Smith calls for a proposed West Coast pipeline to be green-lit within 6 months. Ottawa's major projects office currently aims to complete regulatory reviews within 2 years. A timeline, Smith says, is too long now that the Trump administration has control of Venezuela's oil industry. Duane, I'll start with you first this time. What makes the meeting with coastal First Nations necessary ahead of departing for Beijing?
Well, we don't have a route yet, but I think it's important that the government do outreach to coastal First Nations. Under Section 35 of the Canadian Constitution, there is a duty to consult. This has blocked pipelines in the past. It delayed delayed Trans Mountain. It blocked Northern Gateway, and I think that's the biggest opposition to any new pipeline to BC. Is not the BC government; it is First Nations, particularly those along the coastline, who are very concerned about releasing the tanker ban.
Janet, to what degree do you see today's meeting reflecting added pressure from the Smith government given geopolitical developments? Or is this about setting up for talks in China?
Well, Smith is definitely trying to keep the timeline moving along. She outlined a very aggressive timeline in the memo of understanding, and the premier is committed to keeping to that timeline, if not speeding it up, given the situation in Venezuela. But I think that the prime minister was very smart to have made this stop before going to China. He's recognizing the fact that the pipeline, to succeed, it needs consumers for the oil that it's ultimately going to deliver, but also you have to get that product on ships, and that's not going to happen without some agreements with coastal First Nations and with British Columbia. So I think it was the optics. I think if he showed up in China talking to people about exporting this commodity and didn't talk about the people who have concerns here in Canada about the export of that commodity, it could have been very, very difficult for the prime minister. So I think it was a smart political move to check in with First Nations before showing up in Beijing.
Duane, how likely is the situation involving Venezuela to reshape the Alberta-Ottawa MOU? Could it be that public dollars are to take on more of a role in backstopping, say, a pipeline to the coast?
Well, a couple things. Let's be clear. Daniel Smith has wanted an additional pipeline to the West Coast for a long period of time. When tariffs came in from the Trump administration, she goes, "Hey, I've got the answer. The answer is another pipeline." When the U.S. Attacked Venezuela and took control of the oil industry, Daniel Smith says, "Hey, I got an idea. Let's build another pipeline to BC." So whatever the geopolitical economic situation is, Daniel Smith's answer is a pipeline to BC. It is going to take a very long period of time to build up the Venezuelan oil sector after decades of decay. Trump had tried to bully various oil executives in the White House, and Exxon, the largest company in the world, basically said Venezuela is uninvestable right now. So I don't think there's an economic imperative, but there could very well be a political imperative, and that she's just going to put additional pressure on Carney to go forward on this. But I'll also note that while Carney is in Prince Rupert and meeting with coastal chiefs, Smith is now saying there's three possible routes, one through Prince Rupert, one through Kitimat, but the other through Burnaby. And is that a realization that a route similar to Trans Mountain is going to be the answer because of potential blockages by coastal First Nations?
Jenna, let's put it back to Mark Carney. What's politically at stake where this trip to China is concerned?
Well, a lot is at stake, and he is trying to manage expectations of this trip very carefully. Canada has been at odds with China for almost a decade. This relationship is not going to just immediately bounce back. But I'm sort of reminded of the adage that my enemy's enemy is my friend. And suddenly, we were at odds with China, but now there's a reason to smooth things over with China. But I think the Prime Minister is keeping expectations low because there is a lot of work to be done and not a lot is going to happen in one trip. And then he's also got to manage the uncertainty of Trump. How will Trump react to a stronger relationship between Canada and China? So he's got to try and make headway on this trip, but ironically, maybe not too much headway because he doesn't want to throw things too far off where negotiations with Trump are concerned.
Duane, will there need to be deals done in China with this trip? What does Mark Carney need to come back with for it to be considered successful?
Well, I think that the big thing, and one of the reasons that Scott Moe is on the trip with him, is around canola. And the question is, what are the deals going to be to remove the ban on canola to China? Is that going to be about promises of more oil? Is that going to be about relaxing the tariffs on Chinese electric vehicles? There's a lot of challenges here that Carney is facing because the country is divided. There's different provincial interests at play here. You have the threat from the United States, and there's still a lot of anger from China over the seizure of the two Michaels. So this is a very high, important meeting, but I don't know what can actually come about from it, given all of the moving parts.
Last 30 seconds to you, Janet. How closely do you think the Trump administration is paying attention to this one?
They've got many different fronts that they're focused on. And I don't know about Trump himself, but definitely he's got people assigned to the Canadian file. And Trump is always looking for a reason to blow his top. We saw this happen with Doug Ford's Ronald Reagan commercials. So, if Trump's not paying attention today, it'll be brought to his attention. And Mark Carney has to tread carefully. He is balancing many priorities as a prime minister right now.
All right. We're out of time. Have to leave it there. Great to see you both. Thank you.
Thank you.
Okay. Thanks.